Hey y'all, with my crazy hair, I just wanted to chime in. Somebody brought up a really good point yesterday that when I'm doing my talk about Essure, excuse me, when I'm doing my talk about Essure, that I should really try to include more of a picture reference to kind of show y'all what I'm talking about. So I'm going to flip this around. This is a diagrammatic view of the Essure. So you can see the uterus right here. You can see the coil. Sorry, it's a little shiny. You can see the coil right here on either side. This one doesn't have a picture, but you got cervix, you got the uterus, and then you got this Essure coil. So what I'm talking about when I'm talking about how to remove these is I'm saying that there's a lot of doctors, the number one procedure that doctors are doing when they're removing these Essure coils is they're making an incision on the top of the tube. They're grabbing the coil with a little grasper right here, and then they're pulling it out. The problem is, this looks nice and clean in here, but this actually becomes all embedded, as you can see in this diagram. So what happens is, the coil kind of grows into the uterine, the inflammation grows over it. So when they cut this open, and they grab this piece and they try to pull it, this little piece usually breaks off or is at high risk for breaking off. So that's why I say don't let them do that type of procedure. The second most common thing they're doing is they're just cutting the tube off right here. They're cutting it right through here. They're removing the tube. And then if they can see this piece poking through, they will take it. But if they can't, they're just leaving it. Now the difference in what I do is, if you can imagine this in a 3D picture, is I'm cutting circumferentially around the coil all the way down into the cavity so that all of this comes out in one whole piece. So it comes out, I core around this, cut around, all the way until I get inside this cavity. And then this all just comes out, leaving a little hole here in the corner, and I just sew that closed. And I do that on both sides, and then that's how I take it out. I just think if you cut this open and pull from here, then this is gonna break off, because you see how it's grown into the tube. You can't always slide that out, and there's doctors that do it all the time and they think they get it all, but they're not x-raying, and when you don't x-ray during the surgery, there's no way to know if you're getting that whole piece there. So I don't live in Texas, I'm in Pennsylvania, but have insurance. Yes, I can do everything you need for an appointment if you want to call my office. Anytime you want to call, I'm more than happy to help. 512-956-0296. We're going to be turning the phones on for the afternoon here in about 5 minutes. And then we'll, but I can see you with insurance, order the labs and everything. So one more time, let's just review. Essure removal. The two most common procedures that are being done right now by physicians that I'm seeing is to cut the tube open, grab this little stump right here, pull it out. As you're pulling it though, what you're doing is you're stretching it beyond reason, and it's snapping, and it's snapping, and it's snapping, and it's leaving this piece, potentially leaving that behind. So if they're not doing an x-ray during the surgery, how can they tell you for sure that they're getting this piece out? The other surgery they're doing is to just cut through the coil. They're just cutting the tube, literally cutting it off, and then hoping they can see the part that's still stuck in here, and they're trying to grab it and pull that piece out. Again, no x-ray, again, leaving pieces behind potentially. What should be done, and this is my medical opinion, is that you cut it three-dimensionally, you core around it all the way down until you get into the cavity, leaving tissue on the coil. And then it all slides out in one long piece, and then you just put a stitch in the corner of the uterus. So that's kind of what I wanted to talk about. I think that there's a lot of women out there that are kind of just getting not the best surgical procedure because they're just not, they're being seen by physicians that ideally think they know how to remove it. They think it's easy to do. But they're actually just leaving pieces behind because they're not doing x-rays in the OR. So again, I said this the other day, X-ray X-ray before the case, X-ray during the case. I have chiropractors that are picking up on these now all over the place, and they're starting to send me some Essure removals. I just had a doctor from Dallas area called today. He's got 5 of them that he's found, 5 patients that are having all this back pain and stuff, and he's going to refer them down here to get their Essures removed. So they're getting noticed. They're getting seen on X-rays. You should always have an X-ray before and during the case. If the doctor says he's not going to do it during the case, find another doctor. Simple. It also has been seen that some women who want to know how they had it removed because they don't know how they had it removed, get a copy of your op note. You can, I can do a second opinion and just take a look for you and kind of go over things. No, you don't have to do a hysterectomy. That's what I just described in the photo up there on the wall. If you go back to the beginning of this live, when I make it visible again, then you can see. I just described it going through the picture. The point being is that you don't have to have a hysterectomy if you want them removed, but I would definitely see somebody that has extensive experience removing these things. And I would say that's at least 30 to 50 cases. I've done 800 or so, and I've probably done the most in the country, and maybe in the world, I don't know. And no, your menstruation isn't gonna stop. You still have your uterus, you still have your ovaries, you're still gonna have a period. And the problem is I don't know what that period's gonna be like. So hopefully by removing them, it could get better, but obviously there's no guarantees with that. So just wanted to put that up there. Hope everybody's having a good day. Thank you so much, Brandy. That's very nice of you. Well, Bradley, have her call the office, and I take insurance, telemedicine visit, order the x-ray, order the labs. All she needs to do is come out here for the surgery, and we plan everything. So your period shouldn't stop because of the Essure removal unless you're having some sort of a hormone imbalance, but it wouldn't be necessarily because of the removal or the insertion for that matter. If it's stopped because of the insertion, then it's probably something going on with your hormones. And I do see a lot of hormone imbalances with the coils in as well. They are coated with some neuroendocrine disrupting agents that can definitely cause some imbalances. So even if you just want to talk about your hormones, I'd be more than happy to do that as well. So by all means, feel free to call the office, make an appointment. I can order hormone levels. We can talk about your results and kind of, figure out what's going on from there. And we can also talk about having the Essures removed. So just a little pictorial. Let's just go through. So at the end, for those that are still on, the 3 most common procedures to remove. What doctors are doing is they're cutting the tube open, they're grabbing this little piece, they're pulling it out, okay? That's meaning this piece tends to break, it's very fragile. Snap, 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 pieces left behind. They're not doing x-rays during the surgery. And because of that, they're leaving pieces behind. The other most common surgery is to just cut this off at the level of the uterus and then leave this piece behind unless they can grab it and pull it out. Again, pulling. Then basically what you're gonna find is if the doctor's not gonna do an x-ray, how can they tell you they got it out? What you want them to do is you want them to cut around this in a coil, no pun intended, but a coring fashion, all the way down, leaving tissue on the coil, and then it comes out in one big piece. You put a stitch in the corner of the uterus. I will tell you that it's clinically a difficult surgery to do. Takes a little bit more time than cutting the tube open and pulling on it. And it's just not being done. I mean, I've seen tons of operative notes. If you're worried about what kind of surgery the doctor's gonna do, have them draw you a picture. Have them draw a picture of the uterus and tubes just like back there, and have them show you how they're gonna remove it. If they mention cutting the tube open and pulling, if they mention cutting the tube off at the level of the uterus without doing that coring part around the coil down into the cavity, I fear that there's a high risk of leaving pieces behind. And if they don't wanna do an x-ray, ask them why. How can you guarantee me? There's absolutely no way to guarantee complete removal unless you're doing an x-ray during the case. So just food for thought. I hope you're all doing well. Take care.